Welcome, ladies and gentlemen. My name is Brett Gordon, and I felt it very important right now at this point in time when the vaccine is coming out to really bring up some additional information that you don't normally hear via the mass media, social media, and definitely not from the governments or CDC, the WHO, or whatever. They tend to have their own bias in terms of what they talk about, and I want to try to give you kind of the rest of the story. I did some videos on the COVID vaccine back in May, and you can go back and take a look at those. I provide a little bit more information about myself, as well as really go into kind of what I thought was going to be happening as far as the COVID or the vid virus, and what was going to be happening in terms of the way that the governments and people were going to react, or what could be happening, which unfortunately really did happen. And they shut down, as they had already shut down, the economy. They've been going back and forth doing that, and they haven't been able to stop the vid, especially here in the United States. And I question whether or not they're really being able to do it as well as they say they are in other parts of the world. So, with that, I'm going to go into and actually provide a little bit of a slideshow to be able to enable you to follow along with what I'm talking about as I go through this. And hopefully, it doesn't take too long to be able to get through this. So, I'm going to go ahead and share my screen, and we will move forward. So, here we go. Now, um, the intent of what I'm doing today is really to talk about um, the vid and the vax in ways that you haven't necessarily heard. I'm really concerned about humanity and the direction that humanity is going because of the reactions, the knee jerk reactions that have been taken by the government and promoted by the CDC and the WHO and so forth. And then the misperceptions that the governments are really bringing out in order to be able to get the populations to follow along with what their program is, even though they really don't understand their program. And a lot of that program is really being promoted by those who um, get or have the money. Um, so I'm concerned about humanity. I'm concerned about your families and yourself in terms of the decisions that you're going to make based on the information that you currently know. Now, some of you may already know this information, and I applaud you for actually being able to go out there and actively try to find this information. And the others that haven't had this opportunity, I want to be able to bring it to your attention so that you can make a more educated and conscious decision as to which direction you're going to go with you, your family, and you know your life in general. I'm going to provide, like I said, some information that is not available, readily available through the press for sure. And you have to do the research in order to be able to find the sources for some of the information that I'm bringing out. But it's there. I'm going to talk about 5 specific points to consider when you're thinking about the vid or the virus itself, and then 5 points to consider when we're talking about the vax and what the vax is going to do for you and how well the vax is going to work and that kind of stuff. I really want you to be able to think for yourself by having good information in your hands, or at least getting more of the full story, the balanced story, so that you can choose which direction you want to go. I'm not going to tell you which direction to go. I just want to be able to provide you some information. And lastly, I want you to be able to keep in mind that everything that happens um, tends to have a bias. And when it comes to things like a government program, um, the way that the vaccine and the virus are being presented tend to be biased toward whoever is going to get the money. So follow the money, follow the power. Back further, in order to really start to gain a better sense of perspective on what's going on. So what is it that the government is really, and the misperceptions, some of the misperceptions that are coming out on the vid? The vid is different and more contagious and deadlier than the flu. My question and my premise is that it's not as different as they try to make it out to be. Now, the information that you're going to get from me, it can be found on the www.cdc.gov/flu. If you want to go back and actually do some of the research yourself, that's the stuff that's going to be tied to the flu virus, the flu. And I'm going to be comparing and contrasting the flu to the COVID virus to give you a better perspective on things that, you don't freak out on with the flu, but you're freaking out on them, or people are freaking out on them. When they tie the word, COVID-19 or coronavirus or something to it. And the other information that I'm going to provide, especially with regard to the reporting process, has to do with the international guidelines for the certification and classification, or the coding, of COVID-19 as a cause of death. And that was dated back in 20 April, and it's been followed to varying degrees by different countries throughout the world. The US has actually been reporting, I think, pretty close to the way that it was written by the CDC, when other countries are not doing the same type of thing. So the CDC doesn't really know how many people get the flu each year, and yet they report that so many people get the flu, and the vaccine helps to prevent the flu from getting out of control. Not that many people die from the flu, at least that's the perception that they bring out. But really, over 79,000 people died from the flu or flu-related virus in the United States alone last year. And the year before, really. And they're issuing up to 150 million doses of flu vaccine. So tell me how good the flu vaccine actually works with the flu. We'll go into that a little bit more in detail as we go along. The flu virus is not a reportable disease within the United States by the CDC, unless it is found within children 18 and under, and any deaths of children 18 and under must report that they had the flu, if they know that the children had the flu. Now, we always hear that the flu hits the children and the elderly more than the rest of the people, or the people between 18 and 65. And I question if that's really the case. Parents take their children to the doctor every time the kids, or oftentimes when the kids get a fever, especially if the fever goes up a little bit. So when kids start to get the flu and so forth, they tend to go to the doctor more often. Therefore, the doctors record this and report this, and therefore, certainly children look like they're getting the flu more than people over 18. Then once we get over 18, and usually the working years of our lives, it's like, oh man, I got the cold or I got the flu, but I got to go to work. So we still kind of tough it out. We go to work. If we don't go to work, we still pretty much tough it out and say, I'm going to go to the store. I'm going to get some flu medicine. I'm going to take care of this myself. I'm going to, get some more sleep, take hot baths, whatever we do. And we never go to the doctor. So it doesn't get reported. And that's one of the big non-reporting differences between the flu and COVID. And I'll get into the COVID in just a second, or a couple minutes, I should say. And then the elderly tend to go to the doctor a little bit more because they are more concerned about themselves. They tend to have more time on their hands, and they tend to want the advice of the doctors rather than to tough it out, because they're afraid for their own lives that the flu or a fever could be more impactful on somebody over 65 than between 18 and 65. So the elderly tend to be reported more. Plus, those that are in elderly homes and so forth, they definitely get reported as having flu. Now, when it comes to flu deaths, kind of the same thing happens. Any children under 18 that die due to something that could be attributable to the flu gets reported on the death certificate. Between after they turn 18 and really until the end, it's not a requirement that it be reported on the death certificate. And oftentimes people that die from things like influenza or heart disease or diabetes or whatever may have been aggravated by the flu, but they didn't report or go to the doctor with the flu. Therefore, the doctors don't know that. And on the death certificate, all it is going to say is whatever that primary cause of death was. And it doesn't report the flu. So, do we really know how many people die from the flu every year? No. But if they already say that there's 79,000 people that do have flu related deaths, you can pretty much double or triple that probably in order to, if you were to follow the same guidelines that you have to for any kind of deaths related to COVID. So we'll go on a little bit more on this. As I mentioned, flu deaths per year in the United States range from 12,000 to 79,000. As we have from like 2010 to 2020, there's been a significant increase in the number of dosages of vaccines that have been out there, but there has also been what looks like a trend on the upward side of deaths that occur between those that 10-year period when the vaccine is being distributed even more than it was in the past. The CDC recognizes that the influenza deaths are underreported on death certificates, especially again on the elderly side too, because people may have gotten the flu at home, which then they got pneumonia or they got some complication, heart problems, things along those lines, where they ended up dying, but the doctors knew nothing about the flu in the past. And that flu may have been 2 weeks, 3 weeks, 5 weeks, 8 weeks prior, which makes a big difference when, again, when we start comparing the flu reporting to the COVID reporting. Um, the other reason that they say that the flu doesn't get reported the same way is because there's just the sheer volume of deaths that would have to be evaluated and reported. And there's just a ton of different deaths. And to go into the level of detail in terms of the history, medical history of the person by going, to the family or whatever, just isn't there. They don't have the people to be able to do that. There's a lack of testing. Most people don't get tested for the flu. And they definitely don't voluntarily go get tested for the flu if they're not feeling sick. But that is something that people are doing today with COVID. And then there's different types of coding for deaths. So flu associated deaths, again, often result from complications that are secondary or underlying medical conditions. But because the flu wasn't identified anytime in that person's recent health history, it doesn't get reported. Just some other neat facts about the flu. There's normally between 10 million and 45 million people in the United States alone that get the flu. There's 140,000 to 800,000 people hospitalized because of the flu in the normal flu season. And again, normally the flu season in the United States runs from like November to March, call it. And there's between 12,000 and 79,000 deaths. So there's a significant amount of people that get the flu every year. And that's not something that gets reported readily in the public, or if it does, it's like, okay, here's what happened this year. We got 45 million people had the flu. We had about 800,000 people that were in the hospital, and we had 79,000 people died. That was the headline, and you don't hear about it ever again. So you don't even think about it. You don't really worry about it. Now let's go into the differences here with the virus, the vid. Um, the international guidelines for the certification, classification, or coding for COVID as the cause of death is very specific, and it encompasses anybody from an infant to 110 years old. Any deaths due to COVID, or any deaths where COVID was already identified or suspected in somebody, must go on the death certificate um, as a cause of death. The actual reason that people died is also on there, but because it's in a specific section, the first section of the reporting form, any COVID related deaths are reported and easily tracked. And that's what's happening today. That's why there are so many more people coming down with the virus and dying from the virus. Is the reporting is absolutely required, where with the flu you don't know, and most of the time it's not required. And as a result, the number of flu deaths are way under um, reported, and COVID is probably over-reported, because all you have to do is be suspected of having COVID, and that gets put on the death certificate. Also, with regard to COVID, there is no period of complete recovery from COVID. So if you had COVID 3, 4, 5 months ago, and it was, you went to the doctor, you found out about it, you were tested, whatever, or you said that you felt that way before you died, then they're going to report that as a COVID related death. That could have been 6 months ago. It may have absolutely nothing to do with why you died today, but because you had COVID 6 months ago, they're going to put it on that death certificate as a COVID related death. Pre-existing chronic conditions like COPD, diabetes, or other types of disabilities or illnesses may be reported on the second section of a the WHO, the World Health Organization form, as a comorbidity type of a thing, but they're still going to attribute or count the death as a COVID related death, which I think is a major reason why we're seeing mass numbers of COVID related deaths as opposed to deaths that may be from other causes, even though somebody, they might have had or appeared to have had the COVID virus. Now, even in 2020, the CDC has now come out with a new thing because they're not going to be able to always differentiate if somebody who died from pneumonia got the pneumonia from the flu or from COVID. They're going to start to group those all together, and they're going to try to identify flu-related pneumonia deaths from COVID-related pneumonia deaths. But if you had COVID 6 months ago and then you got the flu today, I question how they're going to report that, but because it is required to report COVID, if they knew that a person had COVID at some point in time, there's very likely that a lot of the people that would have normally been recorded as dying from the flu or dying from pneumonia without the flu being a contributing factor will be recorded as dying from a COVID-related death under the new guidelines and the challenges of trying to differentiate how people got something like pneumonia. Was it the flu? Was it COVID? Next, you tend to hear that your body's not capable of fighting off the vid by itself. You must get tested even if you're healthy, and seek immediate medical attention if you start to feel sick. Now, the flu, again, most people are like, oh, I'm not feeling good. I have a fever. I'm going to take some aspirin, Tylenol. I'm going to get some cold medicine, and I'm going to go to sleep. I'm going to take a couple days off or they may even go into work, which is kind of the worst case scenario. And that would apply to either COVID or the flu, is when you know that you're not feeling good, that you still go out and you interact with people at work, families, etc. That's where we really should be, drawing a line, and how we treat flu as well as how we treat COVID. Um, so first of all, before the vid came, doctors would highly recommend that people focus on building your natural immune systems, doing things that like exercise, breathing deeply, doing meditation, yoga, things like that, that really are breath oriented. Why is that? Because through your breath, you actually bring in oxygen, which everybody knows about, but you also expel a lot of toxins that are built up in your body. That's one of your body's primary ways of getting toxins out of your body. So breathing out is extremely important. And yet today, what we're telling people, doctors are telling people, the government's telling people, the CDC, the World Health Organization, is to stay in your house. Don't go out and exercise. If you go out, or if you try to exercise, wear a mask, which restricts your breathing. Rely, they're telling you not to go to church, not to rely on your normal social organizations, which creates a mental and emotional challenge with life. And again, as we have those mental and emotional type of challenges, as we're basically having our lives changed for us, not that we're readily wanting to do it ourselves, people tend to get more depressed. And just think about it yourself. When you're depressed, you tend to be kind of more like this. Your head's down and you're breathing pretty shallowly, and you continue to do that. Now, if you're doing that and you even have a mask on, it becomes even more so that you're not getting the kind of breath um, work that your body needs, the oxygen coming in, the toxins going out. So what we're being advised to do today is just the opposite of what doctors would normally tell you, what the government would normally tell you you should be doing in order to improve your health and your ability to avoid getting sicknesses in the future. This is something that is absolutely obvious, but many people aren't looking at this. They're so scared because there's so much fear right now, that they're following along blindly these guidelines that the doctors and the media and the governments are talking about, without saying, hey, wait a second, that's just the opposite of what the doctor would have told me a year ago, or now almost a year and a half ago, before the vid came out. And order to be able to be healthier, I should be outside, I should be breathing, I should be doing these types of things, I should go to the church, I should be with my social groups, I should to improve my immune system. And yet we're being told to do just the opposite in today's world. If you get the vid, you will suffer and have a real strong chance of dying. That's what you're hearing on TV all the time. Every time you hear something on the news virtually about the COVID virus, it's not about those that were asymptomatic, barely had any effect on their body. It's always about the person who ended up in the hospital, the person that ended up on ventilators, the person that died from COVID. You don't hear that 80% of the people that get COVID don't show any symptoms or have very mild symptoms, so they don't even think about going to the doctor. And 99.9% of the people that get the vid survive. 99.9. And yet we're so scared and afraid right now that we're going to die from if we get the vid, that people are going down the wrong way in a grocery store aisle and somebody yells at them, like because you're doing that, I'm going to get the vid. I'm going to die. You're threatening my life. It's craziness, the type of fear that people have now because of the way that the media is bringing it up. There, yes, the COVID virus does have some things that when you get it, especially if your immune system is compromised, you're going to potentially suffer more than the flu. But I also challenge that the flu does cause a lot of these same types of challenges to people. And you get pneumonia and they are put on ventilators, they're put in isolation, people die. Now, remember, one thing that came up at the very beginning of the vid is people were being treated and they were being put on ventilators. Now, in a normal situation, a ventilator, once you get put on a ventilator, there's a 50-50 chance that you're going to die. And with the COVID virus, there was an 80% chance that you were going to die until they recognized that they really needed to bring in remdesivir, which helped people. But they also started to shy away from using ventilators. Remember the big push for all of industry, get the car manufacturers and those guys to produce ventilators. Do you hear that anymore? No, you don't. Is it because we have too many ventilators? Yes, but it's primarily because not as many people are being put on ventilators. It was a reason people were dying is by putting them on a ventilator. They would have been better treated, and we do treat them differently today in a lot of cases than we would have at the beginning. Now, if we encouraged everybody who got the flu to go to the hospital, our hospitals would be overwhelmed. What is happening today? People are so scared that they feel that if I got a fever, if I'm not feeling good, I have to go to the doctor. I have to go to the hospital. When you get to the hospital, they look at you, they evaluate where you're at. And because of the potential liabilities of turning away people that possibly have COVID and might get additional complications, the hospitals are admitting people that they would normally, if it was just the flu, probably tell you, here's a prescription for some higher strength Tylenol, take these, get some rest. If your fever doesn't go down in a few days, then come back to me. But they wouldn't be admitting you to the hospital. They would actually be turning you away. I've been to the hospital when I had coughs and fevers and things like that, and they said, it looks like you got the flu, so here's some stuff, go home and take care of yourself. They didn't even think about admitting me to the hospital. Why are hospitals overwhelmed today? A significant reason for those that are not in ICU are because people are so scared they're actually pushing hard that they get put in the hospital because they're afraid if they're not in the hospital that they're going to potentially die at home. And the physicians are also worried about it from the fact that if I turn somebody away and then that person dies, there's a chance that I could get sued, the hospital can get sued. We have a very litigious society here in the United States, which is not good. And as a result, things like COVID are just, like a field day for some of these, what I call ambulance chaser lawyers. And there's these lawsuits that you're already hearing about today about doctors not doing the right thing, even though somebody might have had COVID. It's scary, and it's creating a big strain on our medical system and our medical professionals. So that's a major reason why, and then every day you're inundated with this negative information about how deadly and how many people are dying and the suffering that they're going through. It's creating a mental and a physiological change in your body so that your body actually is getting more acidic. It's becoming more diseased. And when I say that, I mean dis-ease. When you have dis-ease or you're stressed out, your body actually becomes more acidic, and viruses and illnesses like that love an acidic environment. So you're actually creating an environment in your body that is more than likely going to get you sicker than you would have otherwise. Now, again, I said, we really need to focus on our own health, both physical and mental. And the vid indoctrination that we're getting, and I say that with absolute reason, we are being indoctrinated from the government, the news, the social media, stating just how bad the vid is. And if you really look at it, these are similar type tactics that psyops uses in the military. We want to create fear in our enemy. We want to create fear in people so that they follow our direction. And when that type of psyops is used on us on a daily basis, and we don't even really recognize it as such because it's the news, it's social media, it's the governments, it's medical leaders telling us about this stuff, we're getting scared and stressed. The news loves that because that's what sells news. Remember I said follow the money? Happy stories don't sell near as many or attract near as many followers or watchers as depressing things, as traumatic things. And therefore, virtually on any news station that you watch today, the majority of what you hear are tragic, are tragedy, are twists of what actually happened to make it sound more tragic or than it really was. And that's because news stations need to sell advertisements, and you sell advertisements by having more watchers. So they sell this stuff that people tend to tune into more than the happy stuff. So if you were to always hear that 99.9% of the people are surviving COVID and that 80% of the people hardly even know that they had it, would you always tune into the station to hear that same story? No. You tune in because you want to hear that there was 300,000 deaths and there's 150 million cases in the United States so far this year, and it's going to get worse. And the reason it's getting worse is because we're creating an environment in our body so that when we do get COVID, it tends to be worse than it would have been if we wouldn't have had this stress and fear in our body and in our minds. Look, people have been locked up now for 8 to 9 months, locked up in their house, away from their friends, locked out of their jobs, trying to figure out how they're going to pay for their rent, how they're going to pay their mortgage, how they're going to put food on the table. They don't have their support groups that they can go to. They can't go to church. As a result, we are seeing, and this is absolute, that there are more suicides that have occurred this year than previous years. In fact, more children have committed suicide between, I believe it was June and November, than all of the prior year. Why is that? Because they're not able to interact and go to school like they did before. They don't have outlets for um, their energy, and they're being locked up literally, so that their minds are not being motivated the same way they are when they go to school. This is creating a lot of challenges also with domestic violence. There's more domestic violence going on now. There's a lot of domestic violence that's happening and stress within families that are affecting children and adults that aren't being reported. You do hear some of the homicides that may be occurring because of that type of domestic violence and stress, but you don't hear about a lot of the stuff that goes on behind the scenes. And that's the stuff that really impacts people's lives now and forever. So this is really a big, massive change in the way that we're being directed to deal with the vid and the impact that it's having on our lives. Now, the next thing is the world is basically blindly following. That's why I'm trying to bring this information up. I don't want you to blindly follow what leaders and the governments and what the media are telling you, because there is this data. I mean, I'm not giving you any BS about 80% of people not really having any symptoms or minor symptoms from the COVID, and that 99.9% or more of the population that gets the virus actually survives. They tell you how many people died out of the people that actually were admitted to the hospital. That's a horseshit figure, to be perfectly honest, in that it is very much trying to get you to be afraid of this virus, when in fact over 99.9% of the people that do get the virus, including all those that don't get tested because they don't even recognize they had it, are surviving. Not even surviving, some of them are thriving if they're still have their jobs. Others are trying to survive because they don't have their jobs, and yet they also don't have the COVID virus, but they're being highly affected by it. So what about the vax? Where does the vax come in here? The vaccine. Well, I want to present a few things here, and you may not have heard these types of things before, or you might have. And one of them has to do with herd immunity. Basically, what you're hearing today is that there's not going to be any herd immunity, any way to stop the virus, unless you get the vaccine. And the vaccine is distributed to over 70% of the people in the world. Otherwise, otherwise the vid is going to continue to kill people, and it's not something that we're going to be able to create herd immunity within ourselves. Well, guess what? The human animal has been around for millions of years, and we've had novel viruses come up, and coronaviruses come up, and other things that have come up, and it has not wiped out the human race without the vaccine. Why is that? Because our bodies are our best way to combat anything like this. Our natural immune systems, our antibodies, our T cells, our natural defenses are far stronger than the vaccine. So when they talk about the fact that no herd immunity could be gotten without the vax, or so many more people would die, we'll see. I mean, I'm not going to tell you yes or no. I'm going to wait for the data to come in, but I am going to say that we distribute in the United States every year over 150 million doses of flu vaccines, and still 79,000 people died of the flu-related disease or deaths that are underreported, because the flu is not a reportable requirement like COVID. COVID has to be reported anytime somebody gets it. So no herd immunity without the vax. I highly, highly challenge that. There are others out there that challenge that, more holistic or functional, natural type doctors and experts question that. It's the fear of having the virus that's creating the bigger problem than the virus itself. The vax, now again, follow the money. Who's made the money so far because of the vax? Well, pharmaceuticals. They've been given billions and billions and billions of dollars to do this research and fast track a vaccine. And they're going to get billions and billions and billions of dollars every year afterwards by providing the vaccine to the COVID as well as the flu. Oh my gosh, they get a chance to double their money now. And not only is it one vaccine shot that you have to get it 2 a year. Now, it may seem like it's free to you, but that's not free. Either your managed care provider is paying for it or the government is providing for it. But the people that are making boatloads of money are the pharmaceutical companies and some of these non-for-profits that support all of this vaccination type stuff around the world. Now, the next slide is about the fate of the world is dependent on the vax. Again, no, it's not. The vac, with 80% of the people getting the virus without even really knowing that they have the virus, there's a very strong chance right now that if we take a look at the current number of known COVID cases in the United States, you could multiply that probably by a factor of 10, possibly more. That will then start to give you a better understanding of how many people have actually been exposed to the virus. Remember, your body actually builds up immunity by getting a little bit of something many times. So if I'm out near people that have the flu and they're breathing and I'm getting a little bit of that into my body, but I'm having, my immune system's pretty strong, so it's actually detecting it and it's killing it, and it gives me a little bit heightened immune capability. So if I get a stronger exposure to it a little bit later on, my body's already prepared for that. That is how your body normally deals with illnesses, bacterial and viral. So the fate of the world is not dependent on the vax, and we have no idea how many people might be adversely affected by the vax itself. But let me give you another data point that you might want to know about. Virtually no illnesses in the world have been eradicated because of a vaccine. There's only two that are pretty much considered to be eradicated. One is the smallpox, and the other is what they call the rinderpest virus, which is the thing that killed a bunch of cows. So when you consider all of the vaccines that we are given from the time that we're a child and then throughout life, and now, the flu vaccine every year, and now the COVID vaccine, only two viruses or diseases have been eradicated because of the vaccine. Now, there's a couple more that may be coming up on that, but you know what? Those things, those viruses are always out there, and they could rear their ugly head again, especially if there's a mutation. Now, one of the things that we do know about the coronavirus or the COVID-19 is that it has mutated. The strain that was found in Wuhan is different than the strain that was found in Europe. And the strain that is affecting the United States and the bigger part of the world right now actually is the European strain, not the Wuhan strain. The virus vaccines that are being developed are primarily focused on the European strain. Now, if you've been listening to the news over the past couple of weeks, you just found out that in Britain, they've identified two more variants of the European strain, if you want to call it that. So now we know that this virus continues to mutate, and that's what viruses do. Now, if we give a vaccine that's very specific to a particular thing, and I know people are going to say, oh yeah, but it's this protein, the spike that it's focused on, and maybe that spike isn't what's mutating. We don't know that yet. And I can guarantee that there's going to be mutations that are not going to be covered by the vax. So therefore, even if you get the vax, you could still get the vid, but you're going to get a different strain of the vid than the vax is prepared for. Remember, a vaccine is pretty specific in what it keys in on and what it's going to help to build an immunity to. If your body is exposed to more general things, your immune system opens up and actually is able to recognize and fight a broader spectrum of viruses and bacteria than they will get in terms of a vaccine, which is a man-made, very specific type of a point that is used to spark or trigger the immune system in the body. So getting something that's more broad, a broader spectrum, is actually better for your body's immune system, because you're going to be able to handle a broader spectrum of things that come up, even new novel viruses, because you've got something that was very similar to it possibly in the past. So, is the fate of the world dependent on the vax? I doubt it. And those are some of the reasons why I bring that up. The vax is safe and is the savior for the human race. We don't know that. Normally, the vaccine process, and you've heard this, they've got this fast track thing that's going on with all these vaccine approvals for the vid. And it's only been less than a year from the time that they knew about this until the time that they are now distributing a vaccine. In the past, that could be 2, 3, 7 years. Why? Because you need to get longer term testing. You need to test larger groups of people and study them for a longer period of time to see if there are other complications that those vaccines may be introducing into your body. Things like reducing your body's ability to fight off other things, like cytokine storms, which you may have heard of as even occurring because of the coronavirus, where your body's immune system like really kicks into high gear and it doesn't know how to turn itself off, and it starts to destroy itself. That's a cytokine storm. Now, we don't know if the vaccines being developed today are going to have a longer term effect, because they haven't even been tested for a year. They've been tested for months and are being deemed okay to give to the general population. Well, guess who's the test group for the COVID virus and the long-term effects of the COVID virus? The general population. Is that a risk worth taking? I don't know. I can tell you personally, I will not get the COVID vaccine. And I will tell you personally that I have not gotten the flu vaccine since I left the Air Force, where I had to get the vaccine while I was in. Why? Because there are complications and things that doctors don't even know about that are happening in your body when you're introducing these vaccines on a constant basis. And you have to be careful not just of what the vaccine is being, what the vaccine um, component is, but there are carrier things that are being put into your body that are part of the serum or whatever that add to challenges with your body. So I would say that, I will not be taking that vaccine. And I may not be able to travel. Why? Because this is the direction that the governments are going right now. They want to be able to basically force people to get the virus. And in the United States, you really can't do that from a federal level. But what they can do is say, well, if you are an airline and you don't take precautions like making sure that people have had a test or had the vaccine before they get on the plane, and then it's found out that somebody on the plane had the vaccine or had the virus, you, the company, are now going to be liable for the potential that it's spread on the plane, which means that anybody that might have been on the plane that got infected somewhere else would still be able to sue the airline or the store or the restaurant or the hotel. As a result, you're going to start to see some movements toward having a vaccine card or a vaccine record to be able to show that you had the vaccine, and that's going to allow you to get onto the plane, or be required to get onto the plane, or be required before you go into a country. This is the type of thing that is going to force a lot of people to take a vaccine that they might not otherwise have done. And I may have to change my lifestyle in order to be able to deal with that, but I don't feel comfortable with the flu vaccine nor the coronavirus vaccine, and I take very, very few medications. And because I would much rather have my body deal with it than to get external support, um, that I don't know what the additional complications are going to be. And um, that's just something that's my preference. But I want you to really think about that. Think about what's best for you and your family and your children in the long term when you're putting things into your body that you have no idea, and there have been no studies to be able to really be able to predict what a long-term effect might be. One thing that may be, even something as simple as, you know, back in when I was growing up, very few children had bad um, allergies to something like peanuts. But today, the peanut allergy is much stronger, and it's much more predominant. And you know, it was actually, within the 10 years after I was born that they really started pushing more and more vaccines. Is it possible that they could be part of the long-term reason? I don't think the peanut changed, so something changed in what's going on with our population, and a big part of that is a massive increase in the number of vaccines. And guess who makes the money on that? Sorry, just my perspective. Now, you also have to look at control, but we'll not go into that too much here. The vax will stop the virus. As I said, it's not going to stop the virus. The flu vaccine has not stopped the flu from occurring every year. The vaccine gets to be distributed every year. The government pays for free vaccines every year for people, but the government is paying, or your medical program is paying, and there are people that are benefiting from being able to sell more and more of those. So, um, and there's nonprofits that are potentially really doing it out of the good of their heart. But when you really take a look at the implications of what they're doing, it could be worse for the people they're trying to help by promoting all of these vaccines. And last, and kind of summing up a lot of this, the world will return to normal once everyone gets the vaccine. That's kind of the new thing that's coming out on the news. The vaccine is out. Everybody can get it. Once people have it, then there's going to be a herd immunity. Once everybody's got, or more than 70% of the population have it, and the herd immunity is really taking place, we're going to control the virus, which I say is questionable. Not questionable, not going to happen. And that things will return to normal. No, there have been things that have happened that have made life as we knew it absolutely not possible anymore. Think of all the businesses that have gone out of business. Think of all the people that don't have a job. Think of even industries that are going out of business. So people have to find and be trained on new ways to create value, to get a job. There is a massive movement, and this is a good thing possibly, that people going from traditional jobs where they go into work and work for somebody are now going into the gig economy, or are going into their own business. So there's an entrepreneurial thing going on, which may be very good. With every crisis, there's also opportunity. With every downfall, there's an upside. It all depends on where you look. So take this opportunity and really evaluate what's going on in your life. And what are you going to be doing in the future in order to COVID protect yourself from future viruses, and to put food on the table, to thrive in this future world, which is not the one that we just came from a year ago. Guaranteed, that world has changed forever. There will not be the same amount of conventions that there were previous to the COVID virus. What does that mean? That all of these convention centers, all of the industries that supported the conventions will downsize. Is there a potential that could happen in the sports arena? Maybe, maybe not. Not too sure about that because you got fanatic fans that want to be there even today, which would be an amazing thing to see the stadiums filled with people again. But there are industries and there are things that have changed forever, and it will not go back. So you must look forward yourself. What has changed? How has my life changed? How has my industry changed? How have things changed for my children that I'm going to have to be aware of? There's going to be more homeschooling. There's going to be more remote learning. That's good and bad, because today the work and home life have come together as more people have had to work out of homes. But that means that families are stepping on each other's toes more, because I'm trying to work, I need quiet, I'm on a conference call, I'm doing things from home, and you've got kids coming in the door because, hey, mom and dad are home, I need to ask them questions, I want to do things with them, those types of things. Look at what the long-term thing impact is. When you're looking at a house, you might get a house with an extra bedroom that's going to have to be your office, because you are more likely to be offered the opportunity to work from home and may not have an office to go back to um, as often, or there'll be part-time work at home and part-time work at the work location. So the world will not return to normal, and that's guaranteed. So in conclusion, I'm really doing this out of my concern for humanity and people just blindly following things that are being told for them to do. Look at what's really happening. Look at and compare it to what goes on with the flu and the vaccines and the 79,000 people that still die every year, even though 150 million doses of the vaccine are given out in the United States, and probably more than 79,000, probably closer to 150 or 200,000 are dying every year from the flu. They're just not reported the same way that the vid has to be reported. Open your minds. Really open your minds. Do not follow. We don't need more followers in the world. We need more leaders. We need people that are willing to take the extra effort to really find out what's going into their body and what the impact of that may be to themselves, to their families, to their loved ones, and to the people that work with them or for them. I was hoping to provide some information that's not generally known or reported by the press. Hopefully I did that. I also quoted where I got most of this information. It's publicly available. You can go out and verify. I'm not trying to bullshit you in terms of trying to get you to move in one direction or another. I want to balance the scale so that you can make a more informed and conscious decision. Gave you some points on COVID, gave you some points on the vax as to what to consider and what has been said versus maybe what the reality truly is about the vid and the vax. Think for yourself. We need people to be thinking more for themselves and looking out for your long-term future and the futures of your families, and not being so dependent on what you see on TV, read in social media, or hear from your government officials, because those are biased. Has anybody from the government lost their job yet? No. Especially our politicians. Have any of them lost? Have any of them had to give up any of their salary? Have they had to go weeks or months without getting any kind of supplemental income? No, they are still doing fine. So they are more concerned about their next election than they are about your life. So look at it from that perspective. And keep in mind, everything that happens for a reason. And two of the key things to really follow are: where is the money flowing and where is the power going? Our politicians are realizing they've got more power than they had before. Our governors have taken on a whole new realm of powers in terms of controlling their states, their businesses in the states, and their people within the states. Is that a good thing? I don't believe so, because we have politicians in office, not statesmen. Statesmen would be looking out for the best thing for the country, evaluating other opportunities, evaluating other alternatives. In the cases of our governments and our politicians, um, they're definitely enjoying the fact that they can exert more influence and control on the population than they've ever had to before. And it hasn't been for our good, I'll tell you that. And I guess I'll leave it at that. I hope this has been helpful to you. It's just been something that's been going on in my mind. And again, if you go back and look at the videos that I created back in May, you'll see that what I was saying back then really has occurred or is occurring now. And I believe that what I'm telling you today is occurring now and will continue to affect us in the future. So I thank you very much for your time. I respect your time. I'm sorry this went a little longer than I had anticipated, but I really hope that you got some value out of it and it's making you think. All I want is for you to open your mind and really consider that there's other parts of the story that we haven't always heard. And it is the truth. And they try to tell you that the truth is only what they tell you on TV. They're only telling you part of their truth and not necessarily the whole truth. So thank you very much. I really do appreciate it. Remember the tales of the vid and the vax, why coronavirus and the corona vaccine are not what they seem to be. Thank you very much. I appreciate it. If you do have any questions, you can reach me at Brett at businessesarepeople2.com. And I really do hope that we come away from this and thrive. But I think that there's definitely more pain ahead of us, both from the vid and vax, as well as the economic impacts that have been inflicted because of the knee-jerk reactions that have happened so far in this war against the virus. Thank you very much. Have a great life, and I look forward to hopefully being able to provide value to you sometime in the future. Take care.